Now, earlier we told you that the National Association of Nigerian Nurses and Midwives have called off their 7-day strike. To give more insights on this, we are joined by the FCT Chairman of the National Association of Nigerian Nurses and Midwives, Jama Medan, joins me right now. Jama, thank you so much for joining. What were the specific concessions, or will I say commitments, made by the government that led to the calling off of the strike?
Like I said, we have been negotiating with the government on the 9-point issues that we laid down as demands. Number one out of the demands were gazetting of the scheme of service for nurses, and the Honorable Minister of Health has written a letter to the head of service and has set up some few people to follow it up, that the gazetting should be done within 4 weeks. On the issue of gross shortage of manpower, the Minister of Health and shortage of equipment, the Minister has actually told us that recruitment of about 14,000 workers, health workers, for the 2024 was approved, and the recruitment has been concluded, and he has also forwarded another request for a waiver for the 2025 recruitment. And out of that recruitment, 60% of the total number is going to be for nurses. And on the issue of inclusion of nurses in the decision-making body, he has also promised to do that. And our request for appointment of nurses into the board of Federal Health Institution. We have also agreed that nurses will be included in the boardship when the time comes. And concerning the upward review of allowances, we have agreed to meet on Wednesday to conclude on that. The other issues like consultancy in nursing, that issue is also ongoing. But to tell you the truth is that the federal government has actually come into the matter, and after that meeting with the federal government, we now called the next meeting and we presented what they offered, and we all agreed that because of the situation and the condition in which Nigerian found themselves, we have to call off the strike. In the first place, we have never wanted to be on strike for whatever reason, but because we were not given opportunity to dialogue with government or to discuss anything with government, that was why we embarked on the strike that we have never embarked on for the past 40 years.
Now, Jamal, tell me, were there any legally binding agreements signed, or were the resolutions, of course, and also the assurances you just mentioned now, were they just based on verbal assurances?
No, in that meeting, we have about 4 ministers present: the Minister of Health, the Coordinating Minister of Health, Minister of State for Health, Minister of Labor and Productivity, and other people that were there. The document was actually fully signed.
All right, thanks for confirming that. But talk to us about what monitoring mechanisms have been established to ensure government compliance with the agreed resolutions.
We have not actually ended everything, but we are humans. Because of we know the masses have been suffering and people have been the strike. We realize that it has affected a lot of people, so we now decided to call off the strike and continue negotiation. So a part of it, like I said, the association is expected, the Secretary's Office, National Secretary's Office of the Association, and the Ministry of Health are expected to follow up other issues, and at the head of service, and we are going to also meet on Wednesday to continue discussion or negotiation.
All right, thank you so much, Jama Medan, for having this conversation with us.